All right, so somebody wanted to be part of the conversation. So I wanted to touch on liver health and diabetes because this is huge. Never before in history I could say that about everything, all the chronic illness that we've got, but diabetes, and especially childhood diabetes, and now the rise of non-alcoholic fatty liver disease. And, the traditional advice is for diabetics to go on a low-carb diet. Logically speaking, you think the carbs produce the insulin spike, so remove the carbs, you solve the problem. Well, the only issue is, there's a few, but unless you're dramatically overweight, and that's your primary reason for developing type 2 diabetes, that advice is not going to help with your insulin resistance. What you see is people on drugs lifelong, they're not reversing their condition, they can go low carb, but when they eat a banana or they have a massive glucose spike. Same with carnivores, same with keto, people up, down, left, right, got rid of your diabetes. No, you didn't. You're just not eating carbs. What happens is when you have high dietary fat, that inhibits glucose from leaving the bloodstream. So it inhibits the way insulin works and is a true cause of insulin resistance from a dietary perspective. Now, there's other issues with pathogens and, the liver and all of that. But when you go high carb, low fat, whole food, plant-based, and this has been proven over and over again, you can see the work of Cyrus Kambata, PhD, and Robbie Barbero, MPH, and also Dr. Brooke Goldner, absolutely fantastic resource on this, Dr. James Anderson, they're everywhere. So that's the issue. What they also don't tell you, most diabetics are worried about their blood sugar. What you'll also find is most diabetics also have high cholesterol. What they won't tell you, or you may not hear as much, is that diabetics are 2 to 4 times more likely to die from a cardiovascular event. They're also more prone to cancer, autoimmune conditions, the list goes on. So when you're eating a high fat, high protein diet, you might be managing your blood glucose, but you're not reversing your condition, and you're also increasing your risk of mortality from other conditions. So yes, it can be reversed. Type 1 diabetes, you can increase insulin sensitivity and lower insulin requirements. You just have to change your mentality a little bit and work on the diet, and it takes time to unlearn.